o'clock. Welcome to the COVID-19 pop-up panel. Thank you everybody so much for attending. Just a quick announcement, please keep an eye on those handouts section down below. What I'm gonna start doing is adding handouts. So handouts from previous panels are actually gonna be included in your handouts down below. So if you've missed getting some handouts at last sessions, you've got them here and you're ready to download. So there's some really good handouts in there. I have the copies of Anna Murrin's slides from today's presentation. We also have the spay-neuter protocol handbook that Brian put together, and we shared it over the weekend. So that's there and previously. We also have a flow chart that Brian would love feedback on with regards to how to legally determine whether spay-neuter is actually a possibility in your state or not. So go in there and check those out. And then Sara Hollers had sent us a document about her Tiny Tigers program in New York City. And I know had promised to send it out to folks. So I'm hoping there are people here attending and you can go and just download that. So there's a handout section, which is in the control panel. If you can't find those handouts, go ask us in the questions box. Kristen and I will lead you in the right direction. So please check that out. Other announcements, just wanted to do a couple of shout outs and reminders. We do have the online kitten conference coming up June 12th through the 14th. That's done in partnership with the National Kitten Coalition. We have 18 incredible presenters and speakers. And you can go to onlinekittenconference.com to download the whole detailed schedule of presentations. So everything you need to know about kittens will be happening that weekend, and we'll be having a really fun time with that. We also have our Neighborhood Cats webinar series that we do with Brian and Susie. And the next one is going to be focused on the drop trap. And that is a free webinar that will be on Saturday, June 27th from 2 to 4 p.m. Eastern time. And so those are our two upcoming big events that we have going on. If you'd like to be an affiliate for the online kitten conference, feel free to email me at stacy@communitycatspodcast.com if you want to do some fundraising for your organization while getting education out there. Feel free to reach out to me and you can find out more about how to be an affiliate and fundraise for your organization. All right, I'm going to jump right into things here. I'm going to do polls because I have so many polls today. So we're going to get started right on some polls. Right. If you operate a spay-neuter clinic, are you open? Yes, it's business as usual. Yes, but only for emergencies or limited services. No, we're totally closed. If you operate a spay-neuter clinic, are you open? Yes, business as usual is only 6%. Yes, but only for emergencies or limited services, 48%. And 45% say no, we're totally closed. I'm gonna do one more. Are you legally able to perform spay-neuter surgeries in your state? 54% say yes, 16% say no, and 29% say, I'm not really sure. So that's interesting information. Excellent. All right. First off, our first panelist today is going to be Dr. Jeff Young, and he is with Rocky Mountain Veterinary Practice. Excellent. So just to give everybody a heads up, he is out there in Colorado, so you might have a little bit funky internet. If he starts breaking up, we will take his camera off so that then he can hear you. But right now we do want to make sure you can see him and hear him at the same time. So Dr. Young, the floor is yours.
Well, I guess I'm supposed to be talking about COVID-19 and how it's affected us. I mean, we started out a few years ago doing a large amount of spay neuter. That's what I'm known for. And we were doing 16,000 surgeries a year. And now we're down to more like 10, 12,000. But that's because there's so much opportunity in Colorado for people to get their animals fixed. So we're really lucky in Colorado. Our animals have some of the longest longevity rates. We have one of the highest spay neuter rates. Places where they have low spay neuter rates, they have shorter longevity rates for sure. So COVID definitely hit us here. And because we do more emergency bones, fractures, and torn ACLs, explorers, I did 4 explorers on Saturday. The end result is we still kept fairly busy. Now, we did send quite a few people home because we had some high-risk people, and I think it's real important wherever you're working that the high-risk people go home and not work, either go on unemployment or if they can be paid by the companies. We've only been a 100% nonprofit for a year, so this did not come at a convenient time. We haven't written grants, and it's been tough financially. to make ends meet, but we have been able to do some of the higher end surgeries. And for us, our top surgery tops out at 1,500, no matter what it is. So, but we're surviving. The question becomes how important is spay neuter? And my feeling is it never should have been taken off the board. I think we should all been able to, we should always be able to do it. It just gets to be common sense type stuff. And we have ropes out front, we have 6-foot markers, and we're wearing masks inside, and we're asking people to wear masks on the outside, or we definitely have them stand back. So, I mean, I do think you can work around a lot of the essential problems. And I don't know if you're a nonprofit and you depend on money coming in for spay neuter, I don't know how you close down, and keep going. And I think that's my real concern, is that, is everyone going to be able to survive this and pop back open 2 months from now or 3 months from now? And where are we going to stand with how many animals that are born? I mean, when I first started doing spay neuter work, we were killing anywhere from 22 to 26 million animals a year, depending on who you read. And now, depending on who you read, we're down to more like 2 to 6 million. So, I mean, that's a hell of an improvement. And so there's no question in my mind that in terms of suffering and, death, there's no, spay neuter's done more for animals than anything else. Now, having said that, I do believe that we're in a second phase of animals dying, and it's from economic euthanasia. And that's a big thing for me. And that's one reason we kind of switched from being a 100% kind of spay neuter clinic to doing full service, simply because I noticed that too many animals were dying from just simple things like broken legs. And I know a lot of the humane organizations parse words, and it does get to become semantics, like how do you define no kill or low kill, and what's they say, well, we don't euthanize anything that's not adoptable. Well, define that. Is a dog with 2 torn ACLs adoptable or not? So there's a lot of semantics that go on, and this all comes back to fundraising and money, and I recognize that, and the hypocrisy of that sometimes that that we get involved in. But I really do believe that you can do spay neuter and do it safely. Especially cats. I mean, you think about cats. Cats are coming in carriers. That's a real advantage to us. You can drop off a carrier, you can drop off a cage, and you can fill out a form 20 feet away. So, I would definitely encourage anyone that's doing cats in particular to open up and do, get the spay neuter going. Because of the time this happened, we're hoping the whole month of May, we're going to be doing cat spays and cat neuters for $10 a piece. So we want to get as many through the doors as we can. We know we're a little bit behind. And once again, I'm fortunate in that spay neuter is not the biggest part of our money makeup right now to keep us going. It's the other stuff that keeps us going more than that. But in the end, I don't think there's anything more important in my mind than spay neuter. And with cats in particular, 6 by 5 is the new mantra. You get them before they get their, before they have babies. And I think the people who are out there trapping, they should be able to trap once again, by yourself, or just, who you're exposed to. And I think it's important for people to know that COVID's going to be around for a while. It's a SARS virus. It's new. It's novel to us. It's a spillover event, and you have to understand a spillover event. And a lot of these viruses do come from bats, and that doesn't mean we go out and kill a bunch of bats, because it's not going to change anything. There's more species of bats on this planet than all other mammals combined. They've been around for 40 million years or more, and they carry some weird things. But many times these viruses have to go through intermediate hosts, and sometimes they're dead end, sometimes they're not. Obviously, in this case, they're not dead end. Now, cats can be positive for COVID-19, no question about that. But where does the cat get it from? It's going to get it from you, the owner. The owner would have to have it. There's only been a couple cases, and the cats recover fairly quickly. Most of them don't even need a medication. And dogs have been tested positive, only a couple. And once again, it's kind of a rare. Once again, those animals have been exposed to owners that had the virus really bad. The rationale, you see all kinds of things on the internet, people dumping animals and wanting to euthanize their animals, and it makes no sense. It's totally out of control. You're going to give the animal the COVID. They're not going to give it to you. People ask me, what if I take a dog to a dog park? Well, wash them when you get home. If you're not using your dog or your cat as a Kleenex, and you'd have to have the disease, use your cat as a Kleenex, and then have to someone else pet it and then touch their nose. You're just not going to transmit these things in a very amendable fashion, and I don't think you have to worry about it a whole lot. Common sense goes a long ways. If you are sick, it's very possible your dog or cat could possibly have a transitory sickness, and they're not going to die from it, and they're not going to spread it to anybody else. So I don't think I'd worry about that a whole lot. In the end, it's herd immunity. Until we hit about 70% of the population, they either have the disease, so you have the susceptible people, you have the infected people, and you have the recovered, or basically the resistant people. And that's it. That's epidemiology. Now, size of the population, how virulent the virus is, movement in the population, how many people die or don't die, these are all factors. My biggest concern, and I don't consider myself on the front line by any means, but we're dealing with people every day and their animals. But my biggest concern is that we don't get other people sick to where they end up in a hospital, because then that is dangerous for our frontline people. And basically, there's only so many rooms. There's only so many beds in every hospital. So we don't want to overburden them. And that's the biggest thing you have to take into account, is even if, like, I'm not personally afraid of getting COVID, I don't plan on dying from it, but having said that, there's no guarantees. And if I get it, I could spread it to someone else. And that would be my biggest concern, spreading to somebody else. But you think about how we check animals in. You bring an animal in, say you have to carry, you set it down, you fill out paperwork. You can do a lot of this over the phone, which is what we're doing here. We're bringing, like for dogs, which are obviously a little different, or cats, we'll bring them in, put them in a room, and we look at them. The vets look at them, but we're not interacting with the people directly. So we send them back out, and we call them on the phone, we go over everything, and we'll go out and hand them whatever antibiotics or whatever they need. And that's kind of the way we're doing our business right now, minus the surgery side of it. We are legally at this point allowed to do spay neuter. There was a few weeks we weren't able to. We still took pyometers. We took animals that were, we did a few C-sections, things like that. So, I mean, there's some things we had to deal with. We had some cats with urinary issues that were not fixed, and had urinary tract infections. So it was kind of a broad program here, and they basically said if something can't wait for 3 months, then you should get it in. Well, what can wait for 3 months? I mean, an ear infection probably can't wait for 3 months. So we didn't have to slow down a whole lot, but it's more that people just didn't come for a while, and people were dumping animals, it seems like, for a while. But it's kind of rebounded at this point, and we've been real busy in the last week, and we're just now allowed to start going back and do routine spay neuter. So we're stacked up. I got a phone call from the Humane Society that has 40 animals they want me to do. So we can't work them in on any given day because of all the emergencies we're taking at this point. Because once again, economic euthanasia, I mean, we're seeing just increases in prices that just seem ridiculous and almost like price gouging. But you can't get a whole lot done for less than about $5,000 in Colorado. So if we're going to bring in, do an Explorer, and your animal's going to be here for 3 to 5 days on IVs and stuff, we say those tend to be around $1,000. So we really do try to save people money, and we're on a sliding scale. It's tough to make ends meet, and I really feel for a lot of the small humane groups, and I just say, please donate to them first. You save the big groups for last, and donate locally, and try to put money where it makes the most difference. And that's pretty much my 10 minutes. And I just say thank you very much, and I'll answer any questions at the end of all this.
Sure. Excellent. So Anna Murrin is with Metro Denver Cat, and she's going to share her thoughts.
Hi, everybody. So my name's Anna Murrin. I'm the project manager at an organization in Denver, Colorado, also called Metro Denver Cat. And I just wanted to let you know, if you aren't aware of us, we're very teeny, so it's highly likely you don't know about us. But basically, we are a team of 3, 2 full-time people, 1 part-time person who works at our location with people that come to our office and admin. So 2 of us go out into neighborhoods. And basically what we do is a lot of door-to-door outreach in special focus communities to interact with people and get them services for cats. So both pet cats and feral community cats. And the services we offer are professional high volume trap, neuter, return, where we actually do the trapping. We make people free spay neuter appointments for their pet cats and provide transport if they need it, overnight housing too, if that is a problem. And we do free trap rentals for people who live outside of our focus neighborhoods. So we're basically just connecting cat caretakers and people who live in our focus communities to whatever services they need for cats, either things we provide directly or at other organizations. So we are not actually a clinic or a shelter. We're more of a community organization that's connecting people to those services and then providing other things along the way, supplies, and information, and we're also, we do that trapping, so we are physically helping with cats as well. So that's kind of where we were before COVID all started. And in Colorado, it was a pretty clear mandatory shutdown. And the State Veterinary Association, let us know quickly and pretty clearly that routine spay-neuter was not going to be an option when this all started to happen. And our shelter partners that we work with, where we transfer adoptable cats and kittens that we encounter in our neighborhoods, they let us know that they were going to be following the national messaging that would discourage the community from bringing in strays in the short term if they could, and that there were not going to be really good options for feral cats at the shelter. So there wasn't going to be SNR, and for that reason, it was very clear to us that we needed to pause all of the operations, all of the things that I just described that we do, and to let our community know, now is not the time to be trapping feral cats, because if you take them to a clinic, they're not going to be able to get fixed. If you take them to a shelter, they're really not going to have good options for them there. So unless they're like gravely ill or injured, let's just hold for now. And that was pretty, of course it was hard. We really care about what we do at our organization, as everybody does. But one of the messages that we as an organization have always tried to remember in our own operations, kind of to keep some boundaries for ourselves, is that very few of the things that we do as an organization are true emergencies in the short term. So if someone, one of our clients has a cat that is in an emergency situation, there's another organization that is probably what they need. For us, spay neuter is really important, but is it life or death in that moment? Probably not. So what I told my team, we were all bummed to hear, okay, we can't spay and neuter cats right now. It's the beginning of kitten season. This, it's like, this sucks. It sucks for us, but it also sucks for every single person on the planet, pretty much. And the communities that we work in are some of the places that are going to be hardest hit by this whole situation. So and what we do with the cats in these communities is so tied to the people that the way to really be there for the cats in this particular moment is to be at home. Because if we don't have a healthy community for people, the situation is not going to get better for the cats. So that's kind of what we talked about as an organization, as far as dealing with hearing this news about having to stop everything that we were doing, right? And we have all this great momentum going, to just stop was really hard. But keeping those things in mind helped us. Another thing that helped us was we kind of planned for a potential shutdown before we actually got the word from the governor and the mayor that we couldn't go into our office. So we started kind of tapering off some of the things that we do in a logical way. Obviously going door to door at a certain point, we sort of felt like would not make people in the neighborhood comfortable. So we did not want to be putting people in that position. We didn't want to go into people's homes and collect their pet cats like we normally do. We do a lot of that because a lot of our clients don't have transportation. They're not able to really handle their cats to get them to the clinic. So we do that a lot. That was one of the first things we paused. And then we moved to a no contact system for the trapping that we do. And I'll go a little bit more into what that looks like in a bit, because that's one of the things we're going to be doing here soon, hopefully. The clinic started implementing some no contact protocol. And then at a certain point, we said, we have in-office projects we can work on. And then we also made a list of things we could do remotely as a team, just kind of checking off all of those things that fell by the wayside when we were inundated with cats to just get more organized. So that's what we've been doing right now. We are remote, we're at home, staying in touch. I think we are on plan C right now. We had a lot of different scenarios just based on timing. Plan D we have not had to implement, which was, that was more if this situation got even, worse, where there was triage needed as like a disaster response at one of our shelter partners. Luckily, it has not gotten to that level here, and it's not really looking like it will, knock on wood. But just having those plans in place and kind of knowing how we were going to deal with this, at least in the short term, was helpful to us. So as far as projects, hold on, here we go. Well, the main things we've been offering to our clients are, obviously we're not seeing them in person, but we're trying to do a lot of helping people over the phone and email. So we have a hotline that we always try to push people and encourage people to call just in general. But for this time, we've sort of rebranded it as the Kitten Season Helpline, so that people, as they're discovering kittens being born in their neighborhoods, have one resource. They can call us. We will help talk them through their specific situation and help them find a good plan for those kittens, and so that they don't feel like there's nothing out there for them during this time, because we don't want to lose those people. Because if people just think, well, that's too bad, there's kittens, and then we never find out about them, it's going to be a lot harder later on. It's really helpful for us. Obviously, we do a lot of in-person work, and seeing the kittens is always better to give good advice. So what we've had people, when they're able to do, is send us either a picture, or this lady sent us this really cool little video. I don't know if it's going to play. Of her shed where she had this camera set up to monitor the cats, and she wasn't expecting there to be kittens, but she woke up one morning and had this video of them. So for her, in this instance, this is obviously kind of like an ideal situation to find kittens. They're in a really good setup. Mom's taking care of them, but she was able to share this video with me, and I could look at it and see, okay, these kittens are, obviously they're still nursing. They're too young to be weaned from their mom. She's doing a good job with them, and they're safe where they are. So I could talk her through the process of monitoring them, and then being back in touch when they do get a little bit older, for her to start handling them or find a good place for them to go. So things like that have been really helpful. It just kind of helps people feel like there are resources. They don't need to despair. And then we have a good list to work off of when we are able to get back out into neighborhoods. So one of the other things that's been really helpful as an animal welfare community in the Denver area is that the organizations do a pretty good job of keeping in touch and trying to collaborate. So this is just a screenshot of one of the tools we've been using also when we're talking to people, to point them in the direction of services. This is a shared Google document that is live, so all of the organizations can go in and update quickly what services they have available in real time. So when I'm talking to someone on the phone and they tell me what area they live in and we figure out what they need, I can go on this list and see if the shelter is offering that. And so I'm not just like telling people what I think. I actually have the true information to help people. So that's been really, really helpful. Basically for us, looking toward the future, we are kind of in a wait and see mode. The extensions of the stay-at-home orders have kind of come, and we weren't sure, at first it was looking like things were gonna be opening up in the Denver area this week, and then we heard it would be another week. I think a lot of people are kind of doubtful that it's not going to get extended beyond that. So all of the plans we're making for the future are going to be not tied necessarily to a specific date. We're trying to stay flexible with that. But we're right now talking with our partners to see what they are going to be thinking about in terms of capacity. When we do get the word that Denver is back open, what are our partners going to be thinking they can handle? Because that's really all of our operations are tied to what they do. So if the clinics are thinking they're going to reduce their capacity, having that information, knowing the shelters, if they've got, good amount of foster homes for kittens, we don't want to go out into neighborhoods and start overwhelming these organizations and making life harder. As much as we want to go out and round up all the cats right away to make up for this down, we want to do it in like a way that's going to be sustainable and collaborative with our partners. So that's one of the things we're considering as we think about coming back online. Another thing we are trying to do is really react to the response from our community about how comfortable they are with things opening up and ways we can help people feel more comfortable with us being in their neighborhood, because we've really done a lot of work to cultivate relationships with people in the neighborhoods we serve. We don't want to alienate people. For most of the people we work with, the cats that live in their neighborhood are not necessarily their biggest priority, and that's why we're there. We serve cats that aren't coming to the clinics in any other way other than us going there and getting them. So we really need to kind of read the room of the neighborhood and make sure we're doing what we can to not alienate people, so we have those relationships long term, because we're really trying to play the long game with what we're doing. We're also, even though our team is really small, I don't want to do anything that's going to make anyone feel unsafe. So making sure that we're all on the same page about what we think is appropriate and how we're going to make sure we're not getting sick or feeling unsafe at work is really important. Securing all of the PPE supplies we need is something we're working on. That's what we're doing now. As far as the future, whenever the future is going to arrive, which, we're kind of on a wait and see, we are going to go back to working in our neighborhoods kind of in reverse order that we tapered our services off before the shutdown. So we're not going to launch back in right away to doing door-to-door outreach or necessarily helping people with their pet cats going into their homes. What I'm thinking we're going to do is work on our backlog of TNR. And so during this time, we've gotten a lot of calls. We launched a new neighborhood right around the time of the shutdown too. So we had a lot of new clients calling us needing trapping. So we will have enough of that to be busy. And we know we can do that trapping in a no contact way. So basically this chart up here is kind of a chart of how we usually do our trapping. So we, where's the little pointer? Oh, so this is like our headquarters right here that we start the day at. We do trapping during the day, and we'll do this 2 days in a row before our clinic days that we have scheduled. So we'll start the day at our headquarters. We have a van that we fill with as many cat traps as we're going to need, and we drive a route through the neighborhood that we're working in that day. And these houses are houses, people that we've met through outreach, that we've talked to about TNR. We've gotten their contact information. They've given us information about how many cats they're seeing at their house. Usually these are people who are taking care of the cats themselves, or they've had a litter of kittens born in their yard. They're in close touch with the cats in the neighborhood. So we can drive this route. We'll have an idea of how many cats are there, where on the property we should put the traps. And we don't stay at each house to watch to see the cats go in the traps. These are all close enough together that we can drive this route, put the traps out, and then just check the traps throughout the day and pick up cats as they get trapped. So what we'll do, usually in a normal time, our clients are at home sometimes. They'll come out, they'll talk to us, they'll show us where to put the traps. When we go back, we're not going to do that. We have everybody's phone number already. We've gotten that through outreach. So we're going to make sure that if anyone is going to be near the area, they know, okay, don't come out of the house to talk to us. Just call us on the phone. We can go over everything. You just stay inside the house, and we don't need to interact. So it would just be 1 or 2 people from our team in their yard. And obviously we don't come into physical contact with the cats anyway when they are awake. So that wouldn't really be an issue either. So then any of the cats that we trap, they just go stay the night at our facility before the clinic, and then they go to the clinic the next day. They stay overnight with us the night after their surgery, and then we just drive this route and return them. So it should be pretty straightforward to do a no contact style trap, neuter, return. And this way of trapping lets us be really efficient with our time and get a large number of cats on each day that we're doing it. So that should be something we're able to do hopefully very soon. We're also going to develop a way to do no contact trap loans for people who live in neighborhoods where we don't go out and do the trapping. So they'll be able to pick them up outside of our building, fill out the form, anything like that. And then we're going to have to look eventually at probably some alternate methods of outreach, mailers, working with our different partners. We work with Denver Animal Protection, Animal Control here quite a bit. So we'll have some options, but for the first little while, I think we'll be busy enough with what we haven't been able to do in the last 6 weeks or so. So the next thing we're going to be thinking about is really more about like morale boosting for the animal welfare community here, kind of to reinvigorate spay neuter. So during this time when we haven't been able to be out in neighborhoods, you know, we're trying to get a campaign together for our supporters who really want to do something. They feel like they're not being useful. They want to be able to contribute and just not have all this momentum we've built up forever just fall away. So we're putting together some materials and trying to get our supporters to take part in what we're calling like a virtual outreach team, where they can have information to share with their contacts, their friends, their family online and other ways, trying to get some good messaging out there for people who take care of cats, how to do that in the best way possible during this time. We're also going to be doing a sponsor a spay campaign where people can donate, you know, a small amount that will go directly towards helping a cat get spayed once we're back up and running. So we just have that funding ready to go and we're able to hit the ground running. We're thinking about also some sort of kind of like a kickoff event, not something that would be like a large in-person crowd event, but at least something, you know, some sort of shared messaging between all the different clinics that do spay neuter to say like, this is a day that we're all gonna celebrate spay neuter and try to get a bunch of cats done. And, you know, ideally those would be free surgeries, kind of trying to see what groups are doing that. If there's a bigger national movement, you know, tying into that would be great. It's all sort of in the planning phases right now, but just something to sort of reinvigorate and get everybody's energy back, because we know as soon as spay neuter is back and we're out there doing this, there are going to be a lot of cats that need it. I think for me, our program is at an advantage for some of this because we're designed to do a lot with a small amount of people. So we don't rely on big groups for really anything we do. And we can do a lot really efficiently and steadily. So that trapping that I showed you, that little route, we are used to doing that 2 days a week, every week. So it's very consistent, it's efficient, but it's also high volume. So there won't be a lot of barriers to coming back and re-implementing that model. We are also, through our outreach, really connected with the neighborhoods already. We have people that we can reach out to. We know them, we can talk to them, so that we can really feel confident that all our efforts over the years aren't just being undone, because we still have a foothold in those areas. So I think that's going to be really, really helpful. Also, of course, our particular organization does not rely on revenue for our funding. So we're very fortunate in that way. We don't charge a fee for our clients for any of the work that I described. All of our funding comes through donations and grants. So it's a little bit easier for us to stay and just sit for a minute, still engaging our donors, but not worrying that we're missing out on that revenue. So that's kind of where we are. One of the things that we always try to keep in mind, like I was saying, really nothing that we do specifically with cats is like a life or death emergency in this moment, very rarely. And that is something that has helped us really strategize, build a program that's efficient and logical. It can feel easy to get overwhelmed with a lot of the work that we do, but when we get overwhelmed, we aren't as productive. So trying to remember that even during this overwhelming time, I think that will serve us well. So yeah, I'm happy to answer any questions about our model or anything else we talked about at the end, but thank you so much.
Anna, thank you. Thank you so much. That was great, and appreciate the slides. So we have Aimee St. Arnaud here from Best Friends Animal Society.
Hi, guys. So I'm wearing 3 different hats, basically. So I am the founder of a nonprofit spay-neuter clinic, which is temporarily closed right now during this. I'm a co-owner of 2 full-service clinics that try to remove barriers, very similar to what Dr. Young does, that has remained open for surgeries and emergencies and been very busy with that. And then I also do work full-time for Best Friends Animal Society, where we're listening to what's going on with groups with shelters and spay-neuter clinics across the country. And a lot of what I've been hearing is a discussion of, is spay-neuter essential? And I think we all agree that spay-neuter is essential. During this pandemic, unfortunately, it got listed as non-essential, as many human businesses did that I think we can agree are essential. For me, particularly salons. Do not look at my eyebrows or hair right now. Massage places. But I wish that there had been a different word, like maybe routine, because even if a service is closed, I don't think it means that it isn't important or valued, because for me, spay-neuter is a cornerstone of life-saving. So some places did stay open, some places closed down. And I think that, there was kind of a lot of back and forth between that of people having very strong feelings. And I think that, to me, whichever way you went, I don't think we should beat ourselves up over it, because decisions were made in a time of uncertainty, concern for staff, concern for clients, concern for the overall community. There's just a lot of information to process. And I think we all need to give each other leeway, because things are just changing so fast every day, and we're all just trying to do what's best. So for me, what I've really been trying to focus on, because it has been really hard since a lot of the clinics that we work with are shut down, is trying to figure out, how do we now help them restart? Or for those that stayed open, how do we make sure that they feel like they're able to continue to do it safe? And so I think this is a time for us to really look at some creative ways, because a lot of these clinics are going to come back. They're going to have a lot of financial concerns. People are going to come back. We're hearing up to 30% unemployment. So we're really going to have to come up with some things, because this isn't going to go away, and we're going to need to make some adjustments. So I wanted to kind of focus on a couple of things that, like, I'm on a committee right now that is actually putting together some guidelines. We're releasing them on Wednesday. They will be on the bestfriends.org site. And they are some recommendations. A group got together of shelter and spay-neuter professionals to put together some samples and some guidelines to help clinics as they do figure out how to do this safely in this new time. Neighborhood Cats, as Stacy shared, also has some samples, which has some great information in it as well that's here. When our guidelines are available, we'll share those out as well, but you will be able to find them on the Best Friends site. And I think that one of the things that I'm suggesting that leadership do right now, whether you're open but you're maybe limited, or if you're not open yet and figuring out how can you reopen, is to really take some time preparing. And these are some of the things that you'll hear in our guidelines. But So number one, check your supply stock. Make sure, do you have masks? If you don't have masks, can you get some people to sew them for you and get some cloth masks? What drug protocols are you using? Because there are going to possibly be some supply disruption and some alternatives needed. There are some drugs, particularly ketamine, particularly dexdomitor, might be midazolam, Medicam. There might be some that we're seeing shortages in, so we want to be very alert on that in case you have to have some alternative drug protocols to have some of those ready. Our guidelines are giving some alternative drug protocols, but of course you want to make sure you train your staff in those because there are differences in monitoring those animals and differences in how to dose them and how to give them. So we want to make sure that people are really prepared for if there are inventory shortages, how are we going to be able to handle those and still do spay neuter safely? So just making sure that you've got all that sort of thing. And if things change, like, you know, the CDC just came out and recommended face shields for vet clinics if you're dealing with animals with upper respiratory. As things continue to change, can we get what we need to keep doing this? And if not, how can we be creative? So we also are linking to the University of Florida site that has some examples on how you can be really creative in some PPE equipment if you need to, in terms of how to make your own masks and things like that. So really do your inventory. And then number two is how are you going to do your inventory and release? So because a lot of places now are going to be doing either curbside where they're coming out and getting the animal from the car and taking them in, or they're going to be doing very limited intake, one person or two people at a time into the lobby. So now is a great time to be looking into some of those and seeing what other clinics are doing. We're seeing some clinics that are doing like waitlist, restaurant waitlist, like there's a wait me, there's a tables ready that people are doing. Other people are putting numbers on cars, really getting that signage developed because you're going to need to get that signage printed so that it's very clear when people pull up what they should be doing, or if they're coming into your clinic, putting those X's out to separate people out or to explain what to do or how to socially distance. So think about that type of thing of how you're going to do that, how you're going to maybe get your messaging out through email or on your website, on Facebook, what that's going to look like. One thing, if you don't have a software right now, if you do, look in your software and see if it allows this. A lot of softwares are actually allowing where you can do like a paper-light or a paperless system. So Clinic HQ, which is a spay neuter software, they work with about 350 clinics, and they're offering 3 months free right now if you want to get set up, and they'll show you how to do some of this stuff to make curbside appointments really easy. If you don't want to use them, check with your own software and see if that's something you can do. If you are using paper, think about how are you going to do this so that you can make it safe for your staff and safe for the clients coming in. So is that, you know, that you're sanitizing pens in between? Is it that your staff is wearing PPE protection while they go out, and how you're doing the handoff from the animal and getting them into the clinic? So I almost would encourage doing a dry run to see how are we going to do this? Is there going to be a table out there with all of our supplies, and are we going to have hand sanitizer in between? So really just be thinking about how you're going to do those things, because my full service clinic that's open is doing a lot of curbside right now, but we ran into in the beginning, we didn't have the best signage. People were getting frustrated. They were coming up to the door. So making sure you really have clear instructions over the phone and with that. And then also, if you're going to be calling them from inside, do they all have phones? Or if you're going to text them, do they all have data message rates? Because we found a lot of places, a lot of our clients, because we do deal with underserved populations, they might not have a data plan to allow them to get text, or some of them didn't even have phones that we could call. So, you know, just be thinking about all of these things with your clientele, and what do you need to do to adjust so that you can do this safely. Another thing you can be doing right now is looking at how you can maybe reduce the contact that you need to have with people so that you can still do the numbers you need to do, but keep everybody safe. And one way to do that is looking at a telemedicine platform. Now, you do have to look in your states. Every state is different in terms of what they allow and what VCPR is required in order to do this. So you do want to look at your state laws, and that is in our guidelines of how to find that. But you can look at right now, Pet Connect, which is through BI, is offering for shelters, basically, they will take a 5% transaction fee of whatever you charge. But if you don't charge anything for rechecks, so as a spay neuter clinic, if you're doing free rechecks to your clients, you could actually get set up so that you could video call and video chat with people, and they could show you rechecks right over the phone. And then the person doesn't actually even have to come in. The other piece of that is after you do that, if you sign up for that, if you sign up for an online pharmacy like Covetrus or VetSource, any of those, you could actually then send out medications that you may need to send out or refills out to them without ever having to have them come back in again either. So a couple of nice, easy things that you can do. Really encourage you again to focus on getting that messaging and that signage right. And then also, is there anything else you're going to need to put together? So I'm seeing that some clinics are doing a lot of unique things, like if they have really tight spaces that they work in and they can't actually spread out any further, they're actually putting up plexiglass in between the working areas, the exam tables, or in the surgery suite, or they're putting up washable shower curtains where they're doing the exams. I'm seeing others putting X's on the floor. Some who are doing a contactless drop-off where they're allowing their rescue and shelter partners to come in are actually having extra carriers so that when they come in, they can just put them right in the carriers there. They leave, they set up a ring door system or some sort of a notification system, and then the staff comes and gets the animals. So there's some really unique things like that that you can be doing and you can be preparing for and setting up right now. I think now is also a great time to be setting up for ramping up for cat trapping. So obviously not everybody's gonna be out trapping like in huge droves yet, but your staff can really take some time now, inventory your traps, make sure they all work, make sure they're tagged, make sure they're in your system. And now is a great time to buy some traps. So what's on the screen right now is actually Tomahawk is offering 10% off all traps if you use this code through the end of the year. So if you wanna write this down and call them, they're offering this. We just found out that True Catch is also offering the same deal, and I can get you a code for them as well if you prefer True Catch over Tomahawk. But this is a great time to maybe do a fundraiser and get people to help fund so that you can get more traps so that you're going to be extra ready when you are able to trap at a greater rate. And if you have a trap depot, and maybe you've always been wanting to organize it and you just have never had the time, consider putting something together right now. Like there's this thing called easyrentout.com where you can actually use, it's an online trap rental system. So it makes it really easy to rent out traps so you don't have to do it through the normal Excel spreadsheet type of thing. So another great thing might be to have people sew trap covers for you right now. So you have trap covers when you're ready to start trapping again. So these are some things that you can be doing right now while your staff has potentially some time to prepare so that you're really ready to hit the ground running when you do open, or again, if you are open, just to be able to ramp up. The other thing is, now's a great time to do some online trapping classes, showing people how to trap, answer Q&As about cats. I loved Anna's idea, what she's doing with the kitten season hotline. That was brilliant. So those are the types of things we can still be trying to help while we're getting ready to really do more. And then lastly, the other thing is really looking at your finances. I know this is going to be a big thing for a lot of people. What level can you open back up at? So probably not everybody, particularly the clinics that are larger clinics that do larger numbers, you may not be able to open up at 100% right away. So you're probably going to need to phase in. So we're really encouraging people to look at how can you phase in and maybe start doing more community cats, more shelter and rescue partners, so that you're not having to have as much contact with people, bringing them in as you would with the general public, and maybe come back at whatever percent feels good for you, 50%, 60%, whatever, when you can financially handle, and then start adding in some limited public appointments and really prioritizing your surgeries in terms of what that's going to look like. So, really look at staffing levels too. How are you going to be able to do the staffing in a way, because not all staff are going to feel comfortable working, and maybe some are going to have immunocompromised family members at home and not able to, so they're going to have more limited hours. So you really want to look at how much you can do with your staff, and are you going to have to cut back your hours? So one of our clinics, actually, because we are having a staffing issue, actually has cut back to doing 4 days a week instead of 5 days a week, so we can still provide service and with the limited staffing that we have. So if you need help really trying to figure out your financials and you're just trying to figure out what can we do, I'm happy to look at that with you and brainstorm and walk through what other things can you do to bring in some revenue, how can you cut some expenses, what can you do in terms of numbers that are safe, what does staffing look at? We can look at whether it's doing teams, doing shifts. Some groups are actually extending their days. Some are making them shorter, like 4 days. Some are going 7 days, but they're having limited staff throughout so that they're maybe doing less animals per day, but they're able to still do more animals per week. So I think this time for me, I guess the big thing about this is I feel like while it has been incredibly stressful and very, very hard to think about with spay-neuter being limited, I feel like it's also a time for us to get really creative and say, all right, what things that we've had to change are working really well and we want to keep, and what things is this going to make us even be more creative and figure out how we can do even more and maybe end up having better systems. So we're really trying to keep that focus on it in terms of what we can do. But right now, I think the big focus for all of us is how can we all support each other in just making sure that we can do as much spay neuter as we can while still being safe and not putting our staff, our clients, or our community at risk, because we don't want to end up back to where we were. We want to continue to move forward. And I'm happy to answer any questions as well.
Super. All right. So thank you again for all of your comments, and I'm going to make sure everybody gets unmuted so we can hear from the panelists. All right. So get your questions in, folks. I have a question for Dr. Young. If your practice was in New York City or Massachusetts or an area where COVID has really hit at a high level, would you have done things differently with regards to your practice?
I don't think a lot different. I mean, in the end, you know, we sent people home pretty quickly, you know, when this kind of first broke that we thought were high risk. And the reality of it is, and once again, I just feel like if you take, you know, common sense, you know, you keep people at arm's distance. If two people have masks and you keep in your distance, we should be able to do a lot of what we do. I mean, if you have a dog that just ate a towel and is vomiting, I mean, you got to get it in. That's the reality. So for me, I mean, I've survived cancer twice, and also I feel like I'm on borrowed time, so I'm not too worried about me. So I'm going to stay here and work until they carry me out, is what it boils down to. I think it's about keeping people around you safe as much as anything.
Excellent. All right. Thank you so much. Does anybody else want to add any comments to that, or opinions, thoughts, or ideas? If you were in a different part of the country, would you behave differently? Nope.
Yeah, I think it just depends on, I mean, some places there weren't a choice. You know, some places it was stay-at-home orders where you absolutely had to. I think the places where you had a choice, it really is, you know, up to what individuals feel comfortable with and what they can feel they can do. And I think a lot of it is, you know, what the employees feel comfortable with as well. And so, you know, we've heard all different opinions on this, and I think it is kind of up to each individual group and what they feel comfortable with. And I think it's up for all of us to try and share what we can all do and best practices so we can all learn from each other.
Yeah, I think the initial beginning was more clear. I think what's going to get more confusing is coming back. It's already more confusing.
Yes.
Well, I think in the end, you got to look at it like, I mean, almost 80% of people consider their pets part of their family, and they really do have great feelings. And if you aren't in the pets, you don't understand it. But you know, the vast majority of people have pets and they really care about them. So, I mean, all we can do is to try to provide that service, and we can't just let them die. You know, I mean, that's my opinion. Is like, and am I putting myself a little at risk? Maybe, but I mean, I just feel like, you know, if you just take a few precautions and not be fearful about a lot of things and just use common sense and wash your hands all the time, it's not that big a deal.
And I don't know, Dr. Young, if you saw this, but we saw a lot of pyometras, a lot of dystocias still throughout this. We've been doing a lot of prolapsed uteruses. So there's still been very high demand for those, which, you know, you can't wait on those. Those are essential. We've seen a lot of that recently.
Exactly.
What sort of, this is also probably for Aimee and Dr. Young. I'll go with Dr. Young first and then go with Aimee second. Are there any specific consumables that you're finding hard to get, and are you autoclaving gloves?
Well, I happen to be a little bit of a pack rat, and because we do such high volume and we do mobile stuff, I was actually in pretty good shape when this happened. In fact, we took a whole truckload of stuff down to Denver General. The first couple of weeks were really bad here in Colorado, and Denver General ran out of stuff real fast. So we sent a lot of masks. I happen to had ordered a bunch of barrier gowns, and they like quadrupled the order, but instead of sending them back, I kept them. This was like a year ago. So I had whole cases of them. So I sent all those down to the human side. But in the end, we haven't had that much shortage. You can't get azithromycin. I mean, a few things are a little bit harder to come by, and prices have gone up. Just now starting to get masks back in. We're allowed to get 2 boxes a week. You know, but then a lot of people, everyone has their homemade masks now too. So I haven't seen that much difference in all honesty in cost of things, other than very few very specific things. You know, the state of Colorado did ask for us to give an inventory of everything we had. I have not had any respirators, but we do have anesthesia machines, and we sent all that in, and we told them everything we had, but we had donated quite a bit of stuff by that point.
Aimee, do you have anything you want to add?
I think the big thing is to try to have multiple vendors. And so that's another idea, is sign up for more than one, because sometimes one vendor doesn't have it, but you can find it from another. So if you have multiple vendors you're signed up with, it's a lot easier than trying to have to go through the process of signing up in the middle of this. Because we definitely found that for us, it's been really hard to find 6.5 size clubs. So we've been bartering with other people as well. And you know, things come and go. I mean, we've seen different shortages here and there on different things, and now they're starting to come back. We don't know what it's going to be like when everybody opens up at a bigger level. So I think having additional vendors is going to be the best thing to do.
So one question that I guess I'll start with, well, actually, I'll go with a question for Anna. We saw that really nice video that you had of this nice environment, and you're monitoring mom and babies, and everything is pretty. How do you handle the situations that maybe aren't so pretty? You know, how do you triage those kinds of situations?
Yeah, so I mean, obviously that one is like ideal. We haven't, luckily I haven't had a kitten situation come up that at least someone who's called us that has been like, these kittens need attention immediately. We do have some resources for people in those situations. We are partners with an outreach team from Denver Animal Shelter, so they are an essential service. So I've had a couple situations with adult ferals where they're really injured, and their team was able to, we share a space, so basically they could go get a trap to that person, and the person could make sure the cat came into the shelter, something like that. But we're prepared, you know, if someone was to send me a picture of kittens that looked really bad, I have partner organizations that I would refer them to where they could take them. We also partner really well with Denver Animal Protection. So emergency situations like that, we have partners that are active right now that they could be referred to. I've also been trying to talk people through the process of like, okay, make sure, okay, there's kittens coming, you know, there's kittens, there's a snowstorm coming, they're under a bush, like kind of just problem solving on the fly. Like, okay, you have a tarp, put a tarp over the bush so there won't be snow coming in, and then see if there are kitten footprint or mom footprints coming to that area after it snows. That way you'll know if the mom is actually taking care of the kittens. And if not, just call me back. I had another person who she had actually called like on a Saturday afternoon when we were done for the week. We're not 24-hour hotline, unfortunately. I mean, kind of fortunately, because it's 3 people. But she had done a little bit of research over the weekend and kind of found out, because she had a mom who had left 3 of her kittens in a window well and not been back, and the kittens were cold. So she was able to find some stuff online before I even talked to her and got them set up. But I've been in touch with her, so just kind of keeping in touch as new things happen. But for real emergencies, we have places for them to go as well.
That's great. I'm going to do, it's 5 o'clock. If you can believe it, the hour has already passed. I am going to ask you one last question. And this is about sort of the large scale MASH spay neuter clinics that, you know, we've heard about. You know, when is that ever going to be possible for us to happen again? Or is that something that we should just plan on sort of putting off the table for the next sort of 18 to 24 months? I don't know. Dr. Young, you have experience with large scale spay neuter, or Aimee, who wants to chime in first?
Go ahead, Aimee.
Well, I think that we may have to do them differently, but I think we're going to be able to. So it might be smaller. It might not be the way we've traditionally done them. We're going to have to be creative, but we've done that before. There used to not be high volume spay neuter. Nobody thought you could do 35, 40 animals, you know, in a day. And that was created, and now it's here. So I feel like we might have to come up with some different ways of doing them, but absolutely, I think we're going to find ways to be creative and do that spay neuter. And, you know, we are talking with different groups right now about how could we help do a little bit of a rebound, just to help get some groups caught up and do some stuff across the country, maybe in a joint way. So we're looking at some ideas on that right now, but I definitely think we're going to see spay neuter again. It might be different, but we know it's important. We'll find a way.
Yeah, I mean, we're going to do the $10 for cat spays and neuters for the month of May. And, you know, the thing, it's a lot easier for cats, to be honest with you. I mean, you can bring 40 cats in carriers or traps, and it's a pretty straightforward thing. And, you know, it's a half a day's work. But when you start getting the large numbers of dogs, it's a little different. And we usually go to Montana to different reservations. Now, luckily, Montana is one of those very spread out places, not a lot of COVID up there. So I don't know. We're not sure if we're on for this summer or not. That wouldn't be till into July, first part of August. So it's possible we still may keep that on the books. We may not. We canceled our big spay neuter thing down in Mexico in May, but we're hoping to be back down there, you know, in the fall. So this process has to play out. And in the end, until we either have a vaccine or 70% of us, you know, test positive or have gone through us, then we don't have herd immunity, and we need to keep our distance. So I think it's going to be a lot easier to deal with cats in large numbers than dogs for a variety of reasons. But in the end, you know, you just do what you can and prioritize.
Yeah, that might mean we do more weekends, smaller weekend numbers where we can do it safely, you know, or we spread it out over. So yeah, it might not be what we've seen. I know Spayathon in Puerto Rico isn't on again until November, and they'll be monitoring, but I think we're going to create a new way.
Yeah.
That's great. And I know I said that was the last question. One more last question. Many groups halted spay neuter services in an effort to conserve resources, consumables, drugs, et cetera, for human medicine. Is that still a concern that we have?
Well, I don't see it as a human concern other than, once again, azithromycin is probably something they're using some on the human side. You shouldn't be using on the animal side anyway. It should be, you know, a last case scenario. And so a lot of the drugs they use, we're not going to be using per se. And the anesthetics that we're using don't conflict. So I haven't had any problems with our protocols at this point. And, you know, the price of some things seems to be going up. And I'll be honest, in veterinary medicine, things come on and off the market. It's ridiculous. And prices change real dramatically, but that has less to do with what's going on in the medical profession, and more to do with what's going on in the pharmaceutical industry and what they decide what's profitable or not.
Aimee, any comments on that?
No, I think that's good.
We'll save the pharmaceutical conversation for another webinar. And so, well, Aimee and Anna and Dr. Young, I want to thank you all for joining us today. I really appreciate it. This webinar is being recorded, so if you want to have a copy of the recording, please email me directly. We hope to have it up on YouTube eventually, but thank you so much for joining us. You'll also get a survey, and please fill that out so that I can make sure that these webinars are valuable to everybody. And thank you, and have a great—
Can I interrupt real quick before you end things?
Of course, yes.
There is a question in the questions box that the speakers give their email addresses if they're comfortable with that, with people following up with them, and if they could do that, that would be awesome.
All right, so do you want to share your email? Well, Anna had her email address in the slides, so
yes.
they can download the slides, so they've got that there. And then I can send an email out, so I'll collect that, because also everybody wanted all those references that Aimee mentioned. So I'll collect some information and maybe send this out to all the attendees. How about that?
I think that's perfect.
Excellent, excellent. All right. So I'm very sorry if I didn't get to all of the questions. I tried to sort of group them together into a certain package. Unfortunately, we are tight on time, so I do apologize if I didn't ask your specific questions. But I want to thank everybody again for joining us today. Appreciate it. And our next panel is going to be on Saturday at 2 p.m. Eastern Time. And then we're going to also have one on Monday. So be on the lookout on Facebook and on our e-news on who the panelists are going to be. It's a work in progress as of today. So we'll let everybody know. All right. Thank you, everybody.